Who knew? This whole starting a new thing is a really hot topic. You know what? Here's what I know. Right? My goal for today is this. I know this is what started this. I've had so many of my friends come forth just the past week and say the stuff that you're talking about is exactly where I am right now. And you know what? I think it's always wise when you first recognize that something is off. But 2 points before I move forward. Number one, my goal for today is to keep this whole thing on a very positive note. I know that it can be very emotional for a lot of people, but one of the things when I coach individuals is to allow you, or to train you rather, on how to separate your feels from facts. Okay, and that's not saying that you don't have a heart. Right, it's being able to come in and make, objective evaluation about the seriousness of a situation or things as they truly are. And then second is this is definitely more towards let's say career decision rather than relationship. With relationship you're dealing with people, and that's a whole different animal. I mean, there's concepts which will apply, but with relationships, there's conflict prevention, right? There's communication, there's, oh my God, I totally screwed up, there's apology time, there's correction of your action, and, conflict resolution, all that stuff. So this is definitely geared more towards a career, all right? Now, here's what I know. When you are faced with red flags, and it seems that a lot of the chatter in the background has to do with workplace toxicity and or safety issues. Remember, you still have a choice as to whether or not you're going to remain there. So whatever's happening, and I'll be the first to say, those of you who are still working in healthcare, live, my hat's off to you, because even in the past 5 years, there's been like ridiculous changes. Like the demands are out of control. You don't have time with your patients. You've got government influence, you've got socialism, you've got, drug company, insurance company, business. I mean, it's just, one thing's for sure, if you went into healthcare for anything other than honestly wanting to help people, you were just like, like spit out real quick. So for those of you who are still there, like, okay, like honestly, you're there for a reason and you're truly committed. All right, but everything goes through changes over time, and you always have a choice as to whether or not you're going to continue to ride a roller coaster, or is it honestly beyond what you're willing to be a part of anymore, and you're trying to figure out, do I exit stage left? And so here's what I'm going to tell you. I'm going to use a quick analogy, and again, this is for my healthcare people, EMS people. If you have sensitive ears, this is going to involve a case regarding an infant. This will not be the training video for you, but anybody else, you're going to be able to identify with this. And so I'm going to give you the analogy, and then that's going to allow you to make a decision separating out your feels from the facts. Okay, so here's what I'm going to tell you. Let me shut this off so that I can concentrate better here. All right, so there was a call. All right, this was when I was flying. There was a call that we went on for an infant, and all that we were told is that she was sick and she needed to go from, this particular hospital to come back to a peds ICU, and she's like 5 weeks old. We weren't told anything else other than the fact that she was seriously ill. And the hospital where we went for her did not have pediatric services, which was why we were moving her to a place that did. And normally when we went to this hospital, it was like a very routine thing where we would go, get the kid from the ER, and then bring them back to wherever it was that we were going. That was just the path of progression. When we got out of the aircraft, the security guard did not go in the direction of the ER, and we were. And he said, no, that your patient got admitted. And we were joking. We were like, yeah, she totally got admitted. She's 5 weeks old. No, she seriously got admitted. So we're thinking to ourselves, like, wait, they don't even have pediatric services in the hospital. So you're thinking like, and she's sick, right? She's got to go to ICU. So like with every step you're thinking, this is not going to be real good. And as we got up to her floor, you're walking down this really long hallway, and you kind of glance in the rooms, and it was a geriatric floor that she got admitted to. So she's 5 weeks old. She's on a floor where the median age was probably 75, and a lot of older people as well, bedridden, all this stuff. And so now you're thinking to yourself, this lady, this poor baby, she's not even in an area with anybody who's remotely close to her in age. And, the care difference between an infant and an elderly person is just like worlds apart. So as we're walking down the hallway, we saw at the end of the hallway the people who they were clearly her parents, a younger couple. They were crying, but surrounding the couple was actually the entire nursing staff crying as well. So, the three of us, we were silent, because now, like, every radar in your head is like, brah, brah, brah. Who's in the room with the kid? She's on this geriatric floor. You don't even know what the heck you're going to be walking into anymore. And so when we went into the room, the baby was in there, and she was completely purple. Like, she looked like a giant bruise. She was totally purple. There was 3 docs in the room with her, no other nurses, and she was on a cardiac monitor, like portable, so it was like 30 feet of cable. She had a viable rhythm over there, and she was intubated, which was surprising but good, and the 3 docs were geriatricians. And the one that was at the bedside with her had an ultrasound probe in his hand, and he was doing an ultrasound. He looked up, he saw us, and he said, "I'm doing an ultrasound because I don't feel a pulse." And when you walk in, right now, in your mind, it's like, that has nothing to do with anything. But the point of the matter, and it's not meant to be disrespectful to that physician or those physicians or anybody who was at the hospital, is that they were totally blindsided by this event, which was beyond, like, they chose geriatrics as their specialty. So now they're trying to remember, how do you even take care of a kid? I mean, like, all this stuff. But when you become so overwhelmed with stress, sometimes the things that are blaringly obvious that need to take place, you're completely blind to. And in this case, she didn't have a pulse, but nobody was doing compressions on her. And so it was one of those times where, even though you need to be speaking up the food chain, if you will, to a physician or to whomever, that the 3 of us are very clear on what our mission is, and that we're there to do what's in the best interest of that baby. And that is to not just kind of tweak what was happening in the room, like you had to take the train and put it on a completely different track to begin compressions and to initiate drugs and everything else that had to happen there. But we had to actually do a quick reassemble of the team and see who was going to be able to help us. And with all the people that were there, the only other person who was clear in their mind enough to be able to help us was one of the PCTs. And the reason I bring that up to you is because, just like in a patient care situation where things can be so obvious when you walk in, you have no problem calling attention to the elephant in the room. Yeah, sure. Would it be cool to see if we can see any kind of cardiac motility on an ultrasound? Sure, in a science laboratory, but right now the priority is resuscitation of this purple baby, and let's move on from there. And so you're very quick about making those decisions to move things in the forward way, because you're very committed to what you know the goal is to be, regardless of the players in the room. Same thing with your career. You can decide to let your feels get the best of you, or decide to let the stress to build up, and then you feel like you have no options, or you have total meltdown because you've lost all sense of perspective because you're caught up in physiologic stress, right? Psychological stress, and just feeling like you don't even know what to do, and you're not thinking clearly anymore. So what I'm going to ask of you, all right, so coaching challenge for today, is when you are making those decisions, you always are in charge. You have to know what your goals are. You have to operate on a timeline, But within that, making a decision whether or not to stay in an organization, you have to look at the culture. What's going on here? Am I going to stay here and just keep my mouth shut and just ride out my time? Am I going to stay here and try to actually make improvements and change because the end user, our patients, our clients, the community, whoever, is in need of what we know needs to be done and we know what is right? Or is this whole thing beyond my capabilities because I don't have a team, I don't have a band of brothers, or however you want to put it down, and my only option at that point is to actually pick myself up and go to a different place or actually do something new. So separate the feels from the facts. All right, and just like you're able to make very clear and pointed decisions about how you handle the sickest patient that you ever were around, it's the same thing when managing your career. And I'm not looking to make radical anarchists, okay, or cause like acute evacuation of everybody from healthcare. It's that I know each of you to be very strong when it comes to initiating anything within your job role. And usually beyond. But I also know that many times when it comes to making decisions which are on your best behalf, which is ultimately the best behalf of your family and ultimately your patients beyond that, sometimes it tends to get put onto the back burner. All right, so it's a lesson in leadership, right? It's a lesson in self-value, and it's a lesson in separating your feels from the facts. Okay? All right. Mwah. Have a good day.